Hello, everyone. My name is Mark Kagayama, and I'd like to welcome everyone here to the Cancer Conquering Community. This is our regular Thursday meeting at 12 p.m. Eastern, 11 Central, and 9 a.m. Pacific. And we are so honored and happy to have Dr. Ashok Bhattacharya with us today. Ashok, please introduce yourself. Tell us a little bit about who you are, and we're going to get into a fantastic conversation.
Thanks for the pressure, Mark. So my name is Ashok Bhattacharya. You guys can call me Ashok. The origin of that name means without sorrow, interestingly. And I didn't learn that until I was quite a bit older in my life. I've been a doctor since 1980, so been at it for a number of years now. I've been a psychiatrist since 89. I started my residency in 1985. So about 40 years I've been involved in psychiatry. I love what I do, but what I do may not be what you think I do. And since COVID, I've been doing a lot of virtual care using this camera. And I actually have one of these that I use regularly when I'm working with my clients, because I think something that's often missing from the action of healthcare is bringing love into it, bringing love for the work you're doing, helping people find the love for their life, their health, where they're at. As Mark mentioned, cancer especially affects us physically, mentally, socially, and spiritually, for sure. And I'd be interested to hear the group's response to that statement. But I've been interested since I was a child, actually, in a number of issues. One, invisible illness. That's always interested me. And the capacity to express and explain who we are, what we're feeling, and to somebody else. And that's the whole empathy thing. So I was born in England. I had leg perthes as a child, which put me in calipers, much like Forrest Gump, for about 2 years when I was a kid. And instead of playing soccer with my friends in England, I got stuck with the girls. And when you get stuck with the girls, you get to have conversations about feelings and emotions and relationships as opposed to who's got the ball. And I never left that. I never left that interest in speaking about how we feel. How are you feeling? Beyond how is your body feeling, how are you feeling emotionally, but also how are you feeling socially and spiritually. And when I was 18, just a couple of years before I got into med school, my mom got diagnosed with terminal breast cancer. And she lived for 12 years. But the issue with that for me, I got into med school 2 years later. The issue is that every 3 to 6 months, she had to go to the doctor to have that dreadful meeting. Is it going to be, see you later in a few months, or we need to get you in the hospital right away? And this went on for 12 years. And she did eventually pass. But I had so many, we were very close, of course. We were very worried about her prognosis pretty well the whole 12 years. And I can tell you one thing, and Gary may disagree with this, but being a doctor does not necessarily help you with the feelings of cancer. Being a doctor doesn't help you with a lot of things. It gives you information, but it doesn't necessarily help you with empathy. It doesn't necessarily help you with how people feel. And that's my main interest that I've been just really quite obsessed with for years and years and years. When my mom and we would often hang out quite a few times. And we were at a restaurant one day. You know those restaurants that have butcher paper and those little crayons where you can write and color? My mom was actually one of Canada's first art therapists. And she did great work back in the 70s. And we had the butcher paper, just the two of us in the restaurant. They only had, I think, brown and purple and yellow, those colors. So we're drawing pictures, we're making a montage together. And I asked if she had a pen. She said, yeah, yes, here, Ashok, because she's English. And I ripped off a little bit of brown paper and I wrote a little note to her. And I just gave it to her and she didn't look at it. She just put it in her purse. And I said, okay, fine. Um, a few months after she passed, I was the executor of her will. I had to go through her things. And I opened up her purse and she kept that little piece of brown paper in her purse for years. And I opened it up and I had written to her, I will always be here for you. And sorry, it's emotional for me. But and I couldn't be there in her last moments, of course. She passed. But I think that empowered me to think, well, what more can I do? So I've been a psychiatrist, a psychotherapist. I practice mostly psychotherapy with individuals and couples. I've done a lot of palliative care with people who have cancer, and also some people who are dying. Treatment for that part of the stage of life, and we can talk about that if you want to. But what I realized, like a long time ago, and I don't want to sound hostile or negative, but I wasn't trained about empathy in medical school or psychiatry. They did not sit us down and say, "Hey, you want to learn some empathy? That's going to help you a lot." And I thoroughly believe, and always will, that there's a healing aspect to empathy. We're born alone. We pass up from this world alone. In between that, we had the capacity to make connections. And when we make connections, not only is it good as a good feeling, it boosts our immune system. Isn't that cool? That I can have an interactive moment with a client, irrespective of what kind of illness they have. And I see people with all kinds of issues. And at the end of the meeting, they say, I feel better. I cannot tell you how good that makes me feel as a human being. Because that makes me, first of all, that boosts my oxytocin. Helping somebody else actually boosts your oxytocin, which is the feel good hormone, which, guess what, is good for your immune system. And if you're fighting anything from a cold to cancer, that is good news. And that's just one example of the power of empathic connection. Now, let me go back to the issue of invisible disease. Now, I was a kid with all this Forrest Gump stuff on my legs. Everyone could see there was something wrong. Was I bullied? Was I made fun of? I have no memories of that at all. I just had a great relationship with all the girls, as I mentioned earlier. But I have two kids with Crohn's, which, as you know, also has a cancer risk. They have invisible disease. I work with many, many clients who have illnesses that you can't see. They feel it, and depending on the nature of the illness, they may feel an obligation to hide it because maybe there's some shame associated with it, or maybe they don't want to burden people with the weight of their concerns and their illness. And when people say, "How are you?" it might be easier to say, "I'm doing great, I'm doing fine, things are good," as opposed to someone leaning and saying, "Hey, how really are you? I got the time and space to listen to you." So just to gently move on with my definition of empathy, and I'm a real stickler about this because most people get empathy or its definition incorrect. I'm not mad at them. I'm not angry about it, but I think I'm on a mission to change the definition. So there's that group of people who say that empathy is imagining someone as if you were in their shoes. That's sympathy. That's you being you in somebody else's shoes, imagining how you would feel in their shoes. And so when you go to the store to buy a sympathy card, I'm sorry for your loss, I'm sorry for what you're going through, hope you get well. You're imagining how they feel that is simpatico with how you feel. And so we have these phrases in culture which are completely fine, that are sympathy phrases. The difference in empathy is in imagining how they feel in their shoes as them, not as you. And if you want the recording example is play your voice into your phone and record it, and then play it back and ask yourself, does that sound like you? And you will say, that doesn't sound like me. That sounds all nasal. That's not the way I sound. And your friends will say, well, that's exactly how you sound. And they're right and you're right. What's the difference? You're listening to your voice through air. You're also listening to your voice through your body. And if you put your fingers in your ears, you can still hear your voice because you're hearing resonance of it through your body. That adds more depth to the tone. That adds a little bit more bass. I'm a musician, so I think about bass and mid-range. And therefore, when you're listening to your voice, you've got two sounds through air and the resonance through your body. When someone else listens to your voice, they're only hearing your voice through air. Empathy is trying to listen to someone's voice how they hear it. not how you hear it. Yes, I know that's relatively impossible, but trying to do that is the empathic effort. And when you try to empathize with someone, when you try to create that space to say, I want to lean in to listen to what you're thinking and feeling, that's when things begin to change. That's when that person might feel more likely to feel the vulnerability, the intimacy, and the space that you're actually going to listen. Now, I can talk all day about empathy, but I'm going to take a little break if anyone has any questions for me at this point. Go ahead, don't be shy.
Dr. Gary.
Hi, Dr. Ashok. Thank you so
Hi.
much for bringing this incredible message in your work. Um, could you address, and I'm sure you're going to, how to best empathically address when there's been loss in the family, immediate family, tragic loss?
Okay, yeah, that's a great question. And I think when we address anything, the first thing that we have to do is to hold space for somebody. And I remember being in medical school and having to tell people dreadful diagnoses or tell partners or parents that their kid was had just passed away. I think the first thing that you have to do when you're giving some people really bad news or addressing really bad space is to calm your face. This might sound like a weird idea, but I'm quite aware of my face muscles, and I've spent some time in front of a mirror looking at my face and then closing my eyes, imagining my facial musculature, so I can imagine how if I'm looking like this, or expressions that express dread, fear, anxiety, uncertainty. For me, that may not be the best way to engage somebody who you have to tell some difficult news to. So you don't want to look too blank as if you don't care. So a look of some concern, but not being too overwhelmed, I think is something I practice this for years. And so when you feel, I also check my pulse a lot, and my resting pulse is usually around 54. If it's not, if it's a bit higher than that, I'll go to take some circle breaths. Um, uh, 1 minute just to calm down. So the whole initial part of the process is all about me getting my face, getting my breath, getting my heart rate, so I appear to be calm. I think also when we're telling people difficult news from an empathic way, the best way for me is to be clear and straight about it. I try not to use colloquialisms or phrases that are euphemisms for that you're uncomfortable or that you're going to say something that's going to soften the information for them. I think it's nice to have a warm blanket, but it's also nice to have the news so you know what the warm blanket is all about. So the key to empathy, there's many keys to empathy, but one of the key is to have a soothing manner. And that soothing manner comes from how you present yourself, the phrases that you use. And I'm going to talk about something in a moment, but I'll come back to that. And the sense that you're going to tell your story, you give the information as clearly as possible. I avoid things like "you must be feeling." If I'm saying to someone, "You must feel," not only is that not empathic, it's telling them how I expect that they should feel. Because if they are feeling that, okay. If they're not feeling that, they're not going to tell me how they really feel because I've told them how they must be feeling. I think it's easier sometimes to say that many people might be experiencing this, but I'm more interested in how you're feeling about it, and what your experience you're going through. And people will generally open up if you open the door empathically. If you close it empathically, there's less chance they're going to open up and tell you how they're really feeling. And I've been doing this for years, and I know that's generally true. It's not always true. And the empathy exercises or examples I'm giving work about 80% of the time, which means if something doesn't work, it doesn't mean you did a bad job or you failed. It's just that the fit wasn't as good as it could have been. So we have to be kind to ourselves as well when we're practicing any empathic exercise. Gary, does that answer the question?
Absolutely, thank you, and very relevant. God bless you.
Thank you so much, Dr. Gary. Any other questions about what I'm saying so far?
Yeah, I want to input something. I and I know we've all gone through this. What you're talking about is so unique to the, you know, medical profession. And I hear so many different, uh, one of the things we talk about a lot is when a patient gets diagnosed with cancer and the manner at which it's delivered. I wish more people would get in tune with what you're saying, but I don't know how that's possible because every doctor is different, and a lot of times the way they deliver that diagnosis is a part of their personality, who they are. I mean, I wish that more people would take compassion and empathy and caring for the patient as number one rather than just giving this life-changing diagnosis to the patient, which is going to change their life. Chances are it's going to change their life forever. And to be able to deliver that, I believe it's an absolute skill. And our world needs more people to take your approach. What are your thoughts on that?
Well, Mark, you're pushing some hot buttons for me. So I've been talking about empathy. I've been writing about empathy. I authored a book about it many years ago before it was a cool word to be talking about. I've been offering and asking to have at least one course or maybe a few hours in medical school to talk to medical students or dental students or anyone involved, nurses or anyone involved in healthcare about how to approach your patients, your clients, whoever they are, more empathically. And I actually got laughed out of a room in a psychiatry conference when I said the same thing. These are psychiatrists now saying that that's not possible. Well, if anyone's ever taken a wine tasting course where you're pouring the wine, you're swirling it around, you're giving a little sniff, you're looking at the legs and the color and a little sip, and you're told that, oh, well, there's oaky smoky, there's some fruity after this, there's oaky, there's smoke, all these kind of things. And after 20 minutes, you're drinking the wine more empathically. You're learning more about what's in that wine. And I think if empathy is simply leaning into understanding, appreciate someone's experience with more clarity, and you can learn it in a wine tasting course in 20 minutes, I'm pretty sure you can learn that in an empathy course in an hour. And when you say it's a skill, I just want to gently disagree with that. I think it's a human capacity that we can all improve on. I spent a lot of time when I was in my medical training, learning how to do the painless needle. I got a reputation for being good at taking bone biopsies, which are notoriously unpleasant to have to do. And you know what I would do? I would talk to my patient. I would tell them what they can experience next, what they're feeling. This is going to be a little cold. This is going to be a little pinprick. This is going to be a little suction. You're going to feel a sharp pain here. And at the end of it, they invariably said, "Is it over?" I said, "Yes." They said they were expecting a lot more pain. And all I was doing was showing up for them. That's all. And being there with them, asking how they're feeling and telling them. And it helps to be correct about what they might be feeling. And then when they experience that, that builds trust. When people are in a painful situation and there's trust and there's vulnerability, and the physician or the nurse or who is ever interacting with them is making an effort to give them a warm blanket, that experience is going to be better, even if it's dreadful news. And I think, always be soothing. That's one of my rules, as a physician. Am I being soothing with this person? If I have to give someone some really bad news about something, am I being soothing with it? That is a human capacity that I think we can all amplify by thinking about how can I be more empathic? How can I be more empathic with this situation? Unless anyone has a question, I want to shift gears a little tiny bit.
Go
Is
ahead.
that
Go ahead.
I'm going to go ahead. So this might be hard for me to talk about, and if I get upset, it's I'm not upset at you guys. It's just a tough story. So when I was 8, I came to Canada. I love Canada, by the way. It's very good to me. And I met a guy. His name is Niels. We became best friends for really forever. Both our dads were doctors. Both our moms were teachers. I had a crush on his mom, okay, when I was 8, but that's another conversation. Um, and we just got each other. We really he was my, as they say, a brother from another mother, and I have a twin brother. So I mean, this guy was really special to me. We went through so many things together. We both started university at 16 when we were far too young for that, and so we just clung to each other for years. We went through all those transformative adolescent and young adulthood things together. I got into med school. He didn't. He was way smarter than me, but it was a head scratch for me that he never got in. But he called me up when we both turned 61. Sorry, when we both turned 60 and said he's got hemangiocarcinoma of the hepatobiliary duct, which has a less than 3% success rate. It's worse than pancreatic cancer. And I kind of looked at my calendar and I gave him a year or less. He did live for 16 months. Now the problem is this is COVID. He was living in Oxford, England. I was in Canada. I couldn't get on a plane and go out and just be with him. Um, so what we did is we set up a regular weekly call if he was capable. Every Sunday, I'd give him a call and see how he's doing. He was he was doing as best as he could do, is all I can really say. And I couldn't do anything medical. I couldn't do anything psychiatric. I was just a friend, just showing up for him, showing up, and showing up times a million. That's the main message: show up. And when COVID began to ease off, my wife and I were actually able to fly to England. I called my friend Neil, says, "Hey, listen, man, I'm in London. I can get the train up there. I'll be there in an hour." If you, he couldn't take the risk because he was so afraid of COVID. He said, "I can't take the risk." I said, "Look, I'll just stand on the street and wave at you through your window if you can get up and look out." Again, he said he'd rather not. I think he was ashamed for how wasted his body had become as well. He was very athletic. We cycled together. We did all kinds of physical things together. And so I think he felt very conscious of his body. And I got home, and a week later, he passed away. A year later, I was able to get back to Oxford with his wife, and we went to the gravesite where he was. He insisted on being buried in Tolstoy's graveyard, and so I kneeled down by his grave, and I asked his wife if I could have a minute with him. And I had my little moment. I got mad at him for leaving me. I got sad at him for leaving me. I got sad at myself that I couldn't do more for him, that I couldn't have been more there for him. I cried, and put my hand on his gravesite and told him how much I loved him and how much I will miss him for the rest of my life. But that's to me that allowing myself to be vulnerable in that way, allowing myself to be vulnerable with as best as I could with him, but bringing just a morsel of that into the work that I do with people. Doesn't have to be a lot. I'm very conscious of burnout. That's one other issue I talk about. I'm very conscious of compassion fatigue, another issue I talk about. So just enough that the individual you're interacting with feels a bit of that. And I think when someone feels that you care, that you listen to them carefully, we can talk about listening if that's on the bill here, and and that it matters to you and that you're being affected in some kind of a way, and their wellness or their lack of wellness, whatever they're going through, matters to you in a deep way. That increases that connection and that capability for that empathy that can happen. Yes, Mark, do you have a question?
No, no, sorry.
Never apologize in these meetings, by the way. I think we're all We're all wondering how this is going. Is it too much? Is it too little? And
No,
this
no. Everybody loves it. I love it.
yeah, but that's the point though, right? There aren't many communities I'm in where I can talk as openly about my experience with my friend and not be looked like, whoa, that's you're just TMIing, or and I think that's the beauty of what Tim Son is doing, what you're doing is if I had a group like this where my mom was going through cancer, I think that would have been profoundly helpful for me. It would have changed my feeling about myself during that entire time. Um, and I think that that's the power of these communities. Yes, I'm a healer. Yes, I'm a doctor. But when it comes to this conversation, I'm a human being. I'm an earthling. And so are all of us. And when we connect and literally hold spiritual hands on that issue and share that empathic compound interest on that empathic power that we have, some real healing can happen, irrespective of the outcome of that healing, but that healing can happen. Any questions from what I'm saying? Any conversation? Any reflections? Dr. Gary.
Gary,
Uh, you're spot on. First of all, I resonated with what you said on several levels. Being a doctor does not give you immediate compassion, empathy, the ability to create vulnerability in someone. But I think you and I both know that um, through through our, using the studies to become a healer has just been that was literally the tip of the iceberg. The more important thing is what you've been doing and what we try to empower physicians to do, but it's not taught in medical school. Nutrition is not taught in medical school. I learned it mostly in chiropractic school. Empathy and compassion, it really is part of your spiritual makeup and part of your morality and your ethics. And you've just taken that to, a great level. My mom, like many of us, who was irradiated at age 14 by a very stupid dermatologist, developed thyroid cancer as a direct result 18 years later, and throughout my adult life had thyroid metastatic to adeno breast and ended up passing with liver cancer. The very arrogant, non-compassionate, non-empathetic oncologist that sat the family down in that meeting, that diagnostic meeting where he said, my mom, myself, my two sisters, my three sisters uh, were there. And um, he said, Rose, you have 4 months to live. Pack your bags. Non-compassionately, with a flat affect, garden variety oncologist, drug pusher. Um, my mom, because of her incredible resilient spirit, and she was, well till the last 2 months. At that meeting, when he said that, she said, Doc, thanks so much for sharing your thoughts, but I've got some living to do, and this meeting is over. I'm terminating our relationship. Everybody, let's go. So we left, and because I was the healthcare, started out as a nurse in high school. My mom was a medical record librarian with Cedars of Lebanon, Cedars-Sinai, the first medical record librarian. What does that mean? Before the electronic medical record, everything was in paper, as you know. And she actually was my inspiration through her work with that. And in health, when I was an adult, she was managing doctors' offices. So she was a medical office manager, very intelligent, very compassionate. She was the hub of the family. And so what we did for that following 2 years, like you say, is so important, is we spent 99% on loving and compassion, empathy, and experiencing life together, and going to treatment, on Mondays, and then, taking the rest of the day to go to the beach and, go to cafes and enjoy life. And so I closed with my mom, like you did with your friend, and my sisters unfortunately didn't have that experience. So I know personally how important, it is. I, you know, did not learn formal psychology or psychotherapy or counseling. My wife is an Ecuadorian nurse practitioner. She's brilliant. She works in dermatology, and she runs an acne clinic, uh, and she's a psychotherapist to those adolescents that are coming in with their acne problems, which is a loss leader to deep, unresolved emotional issues of childhood, as you know. So I learned compassion. I mean, I learned, therapeutic approach through my wife. So the reason I asked the question before is because we experienced a tragic loss in our family recently, and we're going to be flying out tomorrow. So I just wanted to, you know, have some tools. I was actually before today gonna go on to Grok AI and, ask a prompt question like, how can you provide the most empathic, uh, compassionate counsel to a loved one who's experienced tragic sudden loss? So that's why I asked the question. But thank you. You are absolutely spot on. We need more medical school. They're never going to have nutrition and psychotherapy in medical school the way it should be taught. And so it's just a very rare variety of doctors like ourselves that actually take that extra step to find people's vulnerabilities and address them where they are. So thank you.
So Gary, you said a lot of stuff there, and I don't want to try and minimize any of it by coming up with a package statement. I can't, and I'm not going to try. All I can really do is, where's my heart? Is I'm going to give this, I'm sending this to you right now, and I'm sure this group is too. I don't know you well enough to hug you, but I'm going to hug you right now as well. Too bad. But I think it's kind of connection that we were allowed to have when we don't necessarily feel somebody else's pain. We're sensing their pain the way they're experiencing it. And Gary is really, really good at delivering his message, but he's also good at delivering his emotions at the same time. He's not trying to, he's just doing it. And I think, and we feel it. And that's what makes it powerful. And I think when physicians allow some of their emotions to come in, it's terrible to have to tell someone tragic news. But if you allow some of your emotion, just a little bit's all you need. It makes the difference between telling someone you've got 4 months to live or, no, I don't. I'm going to live for another 2 years. Is that right, Gary? Right. And that is the power of community and love and that connection. My mom was told she was going to live for a couple of years. She lived for 12. Now, it's a long story. I don't need to get into all of it, but I'm just saying that we made sure as a family that she was always surrounded by love. And she was a real easy person to love. I think that makes it easier too. But she was receptive to that, and we were there for her. I think that when we offer that to people, and we do it without an expectation, I'm just going to say unconditionality, if that can make sense to this group, then I think people can feel that. If some conditions apply, read the small print, batteries not included, they can feel that too. Now, I do want to shift gears a little bit because I want to talk about listening. And I think a conversation about empathy that doesn't have some commentary on listening is not full enough. So let's just talk about listening for a few moments. And I really want to hear the group's response to this, also to test to see if you're listening, but that's another little manipulative trick I use. Um, Listening is the hardest thing I do. Giving advice, chirping off it, and all that kind of stuff, talking, that's not that challenging in the sense that, oh my gosh, I'm stressed out to do that. Listening is way harder, way harder. And let me tell you why. The brain is designed for survival. Our brains are ultimately and always in default mode for survival. Experiencing fun and pleasure and all that kind of stuff is momentary, but survival will out trump all of those things. And for those in this group who are dealing with serious diagnoses, serious news from other people, that puts you in survival mode right there. And when you're in survival mode, your brain feels and functions a little bit differently than if you're just at the club dancing or with your friends chugging a beer or whatever you're doing. So what does that mean as far as listening is concerned? So the brain is always like RoboCop or whatever movie you want to reference. It's scanning for issues that could threaten your safety all the time. And if you're driving and you got your favorite music on, it's just great, bobbing around, and suddenly a deer or someone walks in front of your car, suddenly the emotions change because survival will out trump because it's always on in the background, chatting away beep, 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 in your brain. So our brain is always talking to us. Sometimes we can hear it, sometimes we can feel it, but it's always on. And it's the subconscious mind, which is just the rest of the ocean. That little beach you're standing on and that water around your ankles, that's your conscious mind. The rest of the ocean is the rest of your mind, your subconscious. That's a lot to look after. And it's always beep, 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 chatting at you. So let's go back to that. You're listening to someone talk. Your brain is chatting to you. You're listening to them talk, but your brain is chatting to you. Now they're saying things that's causing your brain to chat even more to you. You're trying to listen to them, and your brain is on wildfire, just trying to get everything straight. You might even start looking as if you're now listening to your chatter inside. You're starting to interrupt them. You're starting to want to talk. You want to give responses to answers, blah, 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 blah. That is not listening. That's trying to listen. So why is listening hard? Because you have to shut all that down. You have to shut all that down as best as you can. I know that sounds kind of weird, but if you need to take notes or if you need to write something down or flag something, do that. But listening to someone, even just as they say one sentence, have you heard of the term broken telephone? Yes, broken telephone. Someone tells someone something, they pass it on to the next person. By the time it gets around the room, the original thing was, let's all go for KFC. At the end of it, someone ate a snake for supper last night. So I think that's what happens in our minds. We're broken telephoning our own listening skills. So when I listen to somebody, like for example, when Gary was speaking earlier, I do my very best to shut off everything else that's going on in my mind. Also, not completely, my emotions and reactions to that. Because if you start using your face and you're reacting with someone who's telling you something that's difficult for them, you might actually shut them down. I work on the calm face still. If they say something painful, I might say that's was that really hard for you because that sounds it's really hard. So I won't be ignorant of something they're telling me. But while I'm listening to them, I'm really, really, really trying to shut my mind off. And what does that do? That kind of darkens all that, and now you're just looking at a one candle, which is their voice in front of you talking, and you're focusing on it, and you're absorbing it. It's going into your mind, and once it goes into your mind, you're building an image. You're seeing a palm tree. You're seeing water. You're seeing ripples. I'm looking using William's background here. The blue sky. You're seeing clouds. I'm a movie producer, and when people start telling me their story, I start making the movie. I get the lighting, the set, the cast, and all that, and I'm building what they're telling me into a movie in my mind. And why is that helpful? I notice things that are there, but I also notice things that aren't there. So I can ask them, when you were mentioning that, when you were describing that issue, you said that you were sitting in a chair, but I didn't see the chair in the way you're describing it. So and it's amazing how little details, when you listen, become big details later on. So listening requires self-negation, negating your thoughts, negating your feelings, just long enough while you're absorbing. When it's your turn to speak and their turn to listen, hopefully, and we all know people who are good listeners, we all know people who aren't good listeners. Hopefully they give you the same respect to somewhat suppress their thoughts and feelings and just soak in what you're saying. Empathy requires you to imagine somebody else's perspective from their point of view. If your perspective keeps coming in and coming in, now you're kind of looking through your perspective to see what they're saying, which can cloud your understanding and certainly your appreciation. It is helpful sometimes to reflect and repeat back what someone said to you, using your own words instead of like a parrot. And I might say something like, just so I can get this perfectly clear in my mind, when you were saying this, was it correct that this also happened? And people are either nodding or not. But when you start doing that, and when you start using those listening skills of listen to a bit, reflect back, get accuracy, listen to a bit, then guess what's going to happen to your empathy? it's going to get more and more accurate. And I always say that if you see a guy coming from the desert and he's parched, you got two people. One's got tickets to see the new show in town, and the other one's got a glass of water. They're both kind acts, but look at where he's at. Look what he's going through. He's going to want the water first. And I know that's an extreme example to share, but I think if you make it even more subtle, what does this person need from me? And oftentimes, especially with what I do as a therapist, they just need you to listen. They just need you to listen. And the feeling of having someone really take you in, listening to you, absorbing, reflecting back your story accurately, again, that boosts your oxytocin, boosts your immune system, and sometimes, as Gabby so eloquently pointed out, helps you live longer. Any questions about listening, please? I want to hear this group's opinion.
So many people are so, and what a beautiful, beautiful thing to bring up because I think listening is one of the most incredible things that a person can possess. You know, when you're actually listening to the person, they're telling you a lot of different things, and to be able to uh, empathetically listen to what that person is actually saying can make the biggest difference for your relationship. And what I love the fact that you're bringing this up because listening is a skill, and I have to listen. For instance, we'll get to you, Bill. But for instance, when I do an interview, everything is unscripted, and the way I form questions, the next question for the person is actually by listening. So what they say to me or what they're saying to the camera, I take that and I formulate other questions. And so I think that's such an incredible thing that you're bringing up. And I thank you for that because it's really, really valuable. And it's something, as we grow older, we get uh, tied up in certain things and we start forgetting things and we start overlooking things. And as kids, we're taught to listen to our teachers. But as we grow, you know, it's kind of it can be put aside. And so thank you for bringing that up.
Thank you, Mark. I think William,
Um,
question first, Leah.
Yeah, we're going to go to
oh
Bill
yeah,
first and then
yeah,
Lihia, you're
sure,
next. Okay?
sure.
Actually, it was more of an observation. My background prior to computers is law enforcement. And what you were talking about, um, where very similar to what you said, a lot of the training we get doing investigations and stuff, especially uh, AI kicking in, um, the background that they give us, we learn more from the older officers who learn more about what you were dealing with, what you were talking about, how you weren't really taught. We learned from the older officers how to listen to those people and to understand them. And you have to have empathy with the people that you're dealing with at the time. And if you don't have the empathy, you're not going to get any information out of them. So you really have to understand even some really nasty people. You have to have empathy for them in order to get the information that you're trying to find from them. And when you listen, it's not just listening to words. It's very similar to what you just said. You're actually building a picture in your mind of not just what they're saying, but what they must have been thinking, what their motive was, why they were doing what they were doing, in order to know what questions to ask them later. So it was more of an observation. It's probably one of the more interesting things I've heard recently in the past few days, because I think that really kind of hit home with, with my prior experience. So thank you for that. It is very important.
Yeah, so human beings have been on the planet about 400,000 years. So make easy numbers half a million. We invented speech 50,000 years ago. So that means that for 350,000 years, we were just kind of making gestures and playing with each other and paying intense attention to our facial expressions, our gestures, and these are called meta communications. If I say to you, I completely agree with you, you're going to see my head shaking and not my head nodding. Because meta communications, what we say with our bodies, what we meta communicate actually speaks louder than our words do. And if you worked in the enforcement agencies, you know people lie. And we all lie. We all have to lie sometimes, and we lie as well. When you lean into the meta communications, and as a therapist, I'm checking their pulse. I watch their feet. If they cross their legs, you can watch their feet bob. You can check their pulse. If they're bobbing along at 100 and they're telling me they're fine, I can go in that because I'm looking at all of their communication, not just their words. Yeah, you had a comment?
Yeah, yeah, sure. I have a comment when you were talking about survival mode. I remember one of the most difficult things when my mom passed away. I think I was in survival mode, by the way, because my father was there. They were married for 44 years. So they were always together, and I was the older one. So I remember even I try not to cry, I try not to be sad. I just try to listen to him. So whatever he wanted to say, he wanted to express the way he was feeling, all the pain he was carrying in that moment. So sometimes it was really difficult for me during all those years, just stay there in survival mode and not express also what I was feeling.
Yeah, I can sense some of it right now even. I know you're over
Mhm.
here. I can feel some of this right now. And I know I'm reflecting off my own experience as well. Let me make something clear though, is that human beings are really cool. Like we are so cool. We're so resilient. We're so powerful. We're so capable. We can't really multitask really, but we can sort of kinda. And when I say that we're in survivor mode, when I say things that might feel that we can't do other things, even when we're in survivor mode, we can be extremely creative. We can be inventive. We can be artistic. We can be poetic. We created music. We created dance. We created art. We created entertainment. What is the essence of all of that? Telling a story. And when we tell stories to each other, I always say stories are packages of empathy. When we tell stories to each other, we're sharing not just the content of the story, but the emotions of that story too. And we learn, I'm sure this is true, we learn by stories a whole lot better than if I put all the facts you need to know on a chalkboard and say, memorize these for the test, as opposed to if I put all those facts in a story, told you the story, and didn't even tell you the facts are embedded in the story, and then ask you the same facts, you get them much better. Because I think our brains are designed to hear and feel and relate to stories with each other. And when Mark said, "Hey, do you want to get on a call with these people?" I said, "Yeah, can be about stories because embedded in those stories are the messages carried." Did you have a hand up?
I did. Sorry, I didn't mean to interrupt you, but I did have a question for you, and it goes along with what you're talking about right now. And in order for me to ask you the question, I have to give you a little bit more of my story to give you a bit of context.
Mhm.
I've been waiting to ask this question because of your experience. So when you're talking about survival mode, I've pretty much had a lifetime of being in a different state of survivor mode. So I was born a preemie, so I was born I have cerebral palsy, so I'm no stranger to having to be resilient, even like right from the beginning of life. Um, so, but in terms of the cancer diagnosis and my question has to do with if you're dealing with a higher than average level of stress in your life. I have a son who has complex mental health needs, and so when I received the cancer diagnosis of breast cancer at the time in our lives, not only having to deal with his needs, which are high needs, so compounded stress levels for many years. Then my mother-in-law, at the time that I received my diagnosis, she was she was actually gravely ill and dying in the hospital of Parkinson's, Lewy body. So I was navigating that at the time of just receiving my diagnosis, and then having to deal with a lot of stress to do with doing my treatment, helping my husband with the loss of his mom, helping my son, to the point that because of everything else that was going on, I put off going to the doctor, and it was my friends who said, something's wrong, you need to get yourself checked. I almost missed my window of being able to save my own life because
Mhm.
I could have gotten treatment, gotten a mammogram, and found out, oh, something's really wrong. My question is, um, how do you like? What advice would you give to someone who is dealing with multiple levels of extra challenges? It to kind of if they have to deal with a cancer diagnosis and then ongoing treatment afterwards, how to kind of navigate that without um, missing the window of realizing that you have to take care of yourself, because that's really been my lesson. I've had to learn, what happens when you don't. So I'm just wondering if you have any insight, how to cope with it when there are other factors that are also influencing, your ability to even try to begin to deal with the diagnosis and then the effect it's going to have on your life ongoing. I just wondered what your insights were with that.
Thank you so much, Carrie. So you did a great job of expressing a lot of information to us.
In
And
a yeah,
there's lots of remarkable things about you, but one of them is you told us bad stuff with a smile on your face.
right.
Is that you looking after us, or is that just you?
That's just me. I mean, even before any of this happened, my husband, he always jokes that, I'm Pollyanna. This is my personality, is being positive, being grateful, having a good mindset. Because from the get-go, I've had to have different struggles in life, but I was determined not to let that stop me from reaching dreams and goals. And the big thing when you have experiences like that from a young age, there's a huge difference between trying to be, have empathy for someone and pity. Like sometimes I think people get
Uh-huh.
confused. So I've always kind of felt like I had something to prove in a different way, and I wasn't going to let the physical challenges define me. But when all this came about, already having such a high stress level with my son and then extreme stress levels with my mother-in-law's illness, it was like, oh, come on. Like I got a
Carrie,
lot
I'm going to interrupt you a little bit gently here.
of
So let me give you a life lesson here. You
hmm.
ready?
Yep,
Are you sitting down? You ready for this?
I am.
I'm going to show you a picture. Can you see that?
Yes, I can. Self-care. Yeah.
It's a cup. And the
Yes.
cup is mostly full, but
Hmm.
the upper section is self-care.
Yes.
And the lowest section is the care for others. Now, I'm not going to draw your cup because it might be embarrassing for you.
Okay.
But I'm telling you, this is the cup you need to aspire to. The other analogy, of course, is the yellow mask on the airplane. But
Hmm.
my point is very simple. And you're a beyond lovely person. That's not the question. The question is, can you look after others if you can't look after yourself? Can you look after others if you haven't looked after yourself? Can you look after others if you're depleted, if you're tired, if you're sick, if you're bored, if you're angry, if you're irritated, if you have a toothache even? So I think my one of my lines is my self-care is non-negotiable. Now that might sound kind of selfish, but I'm sorry, I look after a lot of people. I have grandchildren. Like I have a lot of people in my life who rely on me to be capable and physically capable, emotionally capable, socially capable, and spiritually capable of showing up. But that self-care thing, that thing there, you got to pay attention to that. And that can happen as simply as, how am I doing right now? If I gave myself a number from 0 to 10, where am I right now? Where are you right now, by the way?
A number from 0 to 10? I think I'm about 7.
About a 7?
Yeah,
Okay, I give you a
or I
6, but
like
you want to
probably
go
a
a
negative
7? That's good.
getting
Yeah,
there.
but we want to get that up to an 8 most of the time.
Okay.
And again, these aren't things that are always going to work, right? Trying is where it's at. Succeeding is the result of trying. If you don't try, you never succeed. If you do try, you might succeed. That's the goal. That's the whole issue, especially around dreadful diagnoses and trying to get well. We're trying to get well. And I think you, I don't know you at all, so this is, sorry, we didn't rehearse this before we came on the screen, folks. But you, I'm going to say need because that's a strong word, but you need to also check off the self-care, that self-care box. And I check off my self-care box when I wake up, during the day, and before I see a client, and when I go to bed. And I do lots of things throughout the day that are self-care. Some of them take some time. But at the end of my goal is always to seem like I have a lot of energy to do what I do. That's my goal. I mean, can you imagine if I turned up to them like, oh my God, who are these people and what are their names and all their stories? Like, it would be dreadful. It would be dreadful for me. It'd be even more worse for you guys. I do not want to disappoint you, but at the same time, I don't want to stress myself out too much thinking about disappointing you. All I can do is showing up, doing my best, and doing my self-care. After this, I'm going to go for an hour and a half walk. Do you know that? And it just got sunny outside, so good for me. But I'm going to need that, not because this has been stressful, because there's been a lot to process. And I think emotions, you can process your emotions physically, you can process them emotionally, socially, and spiritually. Now, we have all these ways that we can process them. And if I ever meet you again, I want you to hear from you that you've put self-care up in the level of importance and how you look after yourself. And I promise you, and you can slap me on the left cheek, not the right one, if I'm wrong. I promise that you'll feel better. It's not selfish to have self-care, right, Mark?
Right, right. Let me point out something about Carrie. Carrie is like a ray of sunshine to the group. Every time she comes on, without question, she always has a smile. And she just, we love Carrie and we're so happy to have her. And, she's going through a lot all the time, but when she comes here, she is just bright as sunshine.
And I would recommend this group every single time she's on the screen to do an intervention and say, how's your self-care going today? Because she
Thanks.
needs you guys. She needs that.
Great point. We will, Lihia, please take note of that.
Carrie, are you okay with what I just did?
Absolutely. No, that's really great.
Okay, I'm just checking in because sometimes you try things and it doesn't work out. So the last thing I want to do is create any anxiety or pain for anybody in this group.
No, it was great. It's a great reminder for me to keep remembering that I need to take care of myself. I think
Yeah,
this.
but to be a little bit mean with you, you're bad at reminding yourself to look after yourself. You
Yep.
need this group to help you remind you of that. That's the power of community, right? That's the power.
Mhm.
Right. Thank you so much.
You're very welcome, Carrie.
Did you have something to say, Lihia?
No, I was listening to Carrie, and as you said before, she's like a sunshine in this group. The same, I mean, you see her smile is like every time she comes here is the same. It's amazing. Yeah. By the way, when I was talking about my story, uh, I am thinking about what I said before about the survival mode. I remember when my mom passed away, and then 6 years later, my father passed away. So then I remember for the first time, I was really, I mean, I was really devastated and I could express what I was feeling. So then one of my sisters, she came and she said, why are you so bad crying if you are so strong? But in the moment, I was thinking, they don't know how I was feeling all these years since my mom was sick until she passed away, and then listening and supporting my father. But then it comes a moment when we explode, right? When we need to express ourselves.
Well, I always say to people, and I have a large, thick glass table in my office, um,
Mhm.
where, between myself and my clients, and I'm very proud of it. I am fragile, and I am proud to be fragile. I'm strong, and I'm fragile, just like the thick glass on my table. I'm not ashamed to be fragile. I think that's part of my strength. And I didn't cry for years. Like I didn't really start crying till my late 40s. And then my 50s, that kind of opened it up. And I'm 65 now, so I've been crying for 15 years. But be able to feel your emotions and react to them emotionally, feel them and connect with them, that is so much healthier than looking strong, meaning you're a wall of concrete.
Mhm.
None of us are walls of concrete. We might look like it. And if you've ever seen Save It Private Ryan, we haven't talked about PTSD and maybe another time, Mark, but every time you seem to be, I'm really strong and I'm not going to show my feelings, that actually weakens you. That actually
Mhm.
weakens you. And I never assume people are so strong that they can't share their feelings. And I do a lot of PTSD work with firefighters, emergency workers. And when they come in my office, usually it's a kind of standard issue. They come in, these great big people with big shoulders, and you sit down in 30 seconds, they're sobbing. They can't talk for 5 minutes. And I said, that's okay. And that's probably the most helpful thing you've done for yourself in a long time. Just let those feelings pour out of you because that stuff
Mhm.
in your body sticks in your heart, sticks in your immune system, and makes you sick. And there's science on that stuff. I've got about 3 more minutes to wrap this up, Mark. If people have any questions, if people want to reach me, by the way, reach out to me. I'm on LinkedIn every day. I'm really easy to find. I think I'm the only Ashok Bhattacharya in the universe there. I have a YouTube channel, got a couple of books I publish as well. And if I can help any of you in any way possible, if you'd like me to help you out with some of the content we've spoken about today, I'm available. And Mark, if I don't get a chance later, thank you so much. And I'm sending love to you right now.
I owe you an apology, Ashok. Uh, I apologize for the fact that we haven't connected again sooner. I mean, this has just been so incredible, and I'd really like you to come back and share again at a later date. And because this has been, I don't know, let's have a show of hands. Has this been phenomenal or what? Everybody. So thank you from the bottom of
Amazing.
our hearts. Uh, Absolutely. And Dr. Gary has one final question, and then we're going to wrap it up.
Dr. Ashok, we are so incredibly blessed to firstly have, Mark created this community, but also having you giving your time and special message and sharing to this community. I feel like that we've just wrote $1 million, multi-million-dollar check for therapy to this group.
Mhm.
It's very rare that people in healthcare or in cancer groups have the opportunity to speak with a physician who's schooled in, functional counseling and giving people the tools necessary. I mean, especially this was important for all of us, but myself, just learning how you approach with your knowledge, training, experience, the ability to bring out of people that are suffering through catastrophic challenges or, like Carrie said, multiple competing catastrophes. When having a diagnosis of catastrophe yourself, um, just knowing how to check yourself, address your self-care, address your biofeedback. Are you in the right place, in the right space to eliminate the subconscious ocean while you listen to someone, loved one sharing, catastrophe or bad news. I think that was just a gem, so important. My comment, I could give you commendations, but we're very blessed and thank you. And I wanted you to just like identify, we're in an age of artificial intelligence right now where you can pretty much get the answer to everything at PhD level within seconds from Grok and ChatGPT. Um, Grok is Elon Musk. They've actually created sympathetic, I won't say empathic AIs with female and male personalities uh, in the Teslas that we drive. So, but that can never replace organic intelligence that you're speaking of today. So I think it's important, and we would love you to come back uh, to talk about the importance of knowing the difference between organic and artificial intelligence when it comes to counseling. It's a loaded question.
No, it's not. It's not a loaded question at all. I think that there's lots of people who lack empathy terribly. And you get on an AI app and the empathy is actually better than a human being. But so let's not say that it can't work. I think the problem is, can AI intuit with less information? So if you write a part of a sentence or a part of a word and a part of it gets erased, most of us can intuit the rest of the information. And when I'm speaking to someone I've just met, I'm constantly intuiting until I get more and more of the ocean of them into my space so I can see more and more of them. But I'm constantly doing that. If AI can do that accurately, great. But I'm looking at things that aren't their words. I'm looking at things that are I'm feeling things. When you guys were talking to me, my emotions were blowing up. I was feeling all kinds of things. And I'm not going to unpack all that with you guys, but that's empathically resonating with you. Can a machine do that? Well, maybe one day, someday, but not yet. So I've been known to ask people completely non sequitur questions in the middle of a meeting because I just had a feeling, and they'll say, "How did you know to ask that?" And I don't know. It's just intuition, 40 years of experience, and just practicing MP all day long, and still practicing it. So if a machine can do that, fantastic. I get asked by AA coders all the time, what should we do to make AI more empathic? I'm happy to have that conversation, but it's that intuitive space, that hunch, that little moment that you just feel something and you twinge and then you go into it. Now you're in a new space. Good luck. Good luck inventing that.
You're talking about intuition, like the physical signs that you're seeing with your eyes that the computer cannot see.
No, I'm talking about spiritual intuition.
Yeah.
I'm talking about the aura, the energy, those non-describables that we talk about. That's almost a quasi-religious experience for me. So I think it's that kind of stuff that I think I find it very. I've been feeling this since I was a kid. I mean, I can tell you stories, and they just sound bizarre, but they're just me resonating with my environment. But you know what, guys? We should probably do this again because we haven't unpacked it all today.
Yes,
So
definitely.
if you
I
dare to
will.
have me back, I'll be happy to do that.
I will reach out to
Mhm.
you, Ashok, and we'll set something up. I think everybody was, so pleased and happy to
Yeah,
see you today and hear from you,
phenomenal.
and we really appreciate you and thank you from the bottom of our hearts. What I'm going to do right now is I'm going to close out the recording. So I just want to thank everyone for joining us here at the Cancer Conquering Community, and we will see you next week, same time, same place.